Hello, I'm Dr. Winston Richards from the University of Florida Department of Surgery and the Division of Acute Care Surgery. Today, my colleague and I would like to discuss traumatic injuries of the hand, their triage, and criteria for transfer to a center with hand surgery specialists. We will review statistics regarding hand injuries in the state of Florida, clinical management of some of the most common injuries, and finally, transfer criteria for these patients. Given the intricate nature of hand anatomy and function, our recommendations are aimed at obtaining the best results for treatment of these injuries. All transfers must take into account the whole patient and address multiple trauma through ATLS guidelines using the recommendations for hand injury when all other systems are addressed. Remember to treat the life-threatening illnesses before the limbs. Florida has great weather, a growing population, and with that, a large number of hand injuries. We evaluated the Agency for Healthcare Administration database of inpatient hospitalizations over a 9-year period from 1997 through 2005 and found over 18,000 patients who were admitted and required surgery for hand and upper extremity injuries in the state of Florida. 70% of them were male, and the great majority of them were of working age, 18 through 65 years. In 2005, there were 356 finger amputations, 80 thumb amputations, and 12 hand, wrist, or arm amputations. We found an increasing trend in the number of these injuries over the 9-year time period that we evaluated. After evaluating this data for site and source of injury, it was apparent that approximately 34% of the injuries occurred in an industrial work site. 26% occurred at home, and over 50% of these injuries occurred while the patients were using woodworking equipment such as table saws or circular saws. These injuries were associated with significant costs. For example, the total hospital charges for a patient who was admitted with the diagnosis of a finger amputation was $23,000. A patient with a thumb amputation, $28,000, and for an amputation of the hand, wrist, or arm, the total hospital charges averaged $81,000. This does not include the cost of rehabilitation and the lost wages during the recovery period. Hand injuries are common and costly. The management of these injuries requires the efforts of every part of the emergency medical system. Pre-hospital management of the patient with hand injury follows closely with ATLS guidelines. Specific to hand and arm injuries, assessment and control of bleeding is the primary objective. Stop any bleeding. Direct pressure over the wound is the preferred method of controlling bleeding. Do not use a tourniquet. Estimate blood loss on the scene to assist in the resuscitation of the patient and collect all parts. Again, any part can be useful for reconstruction of the injured limb. When transporting the injured patient, it is important to transport the injured parts in a way that will preserve their viability. The amputated part should be wrapped in saline-soaked gauze. The gauze-wrapped part should then be placed in a plastic bag and labeled. This will account for the situation where there are multiple amputated parts and multiple patients. The plastic bag should then be placed on ice for transportation. Never let the tissue directly touch the ice. This will lead to irreversible damage of the amputated tissue. These recommendations, along with ATLS protocols, will prepare the patient for transportation to the nearest emergency facility. At this point, I would like to introduce Dr. Loretta Cody Faraborzian, who will present soft tissue injuries and their initial management in the emergency department.
Hello, I'm Loretta Cody Faraborzian. I'm with the Department of Surgery,